At Cupid Lips, we'll have the most advanced type of lip treatments available. One of these treatments I'm very excited about and I've developed over the past 7 or 8 years, and it's called PHAT Lips. PHAT is PHAT, Platelette Hybridized Adipose Therapy. We've published on this for hair loss, and I've used it for years and years and years to help treat damaged skin and the areas under the skin. What most people don't realize is, although we only notice the parts of the face outside that are aging, internally under the skin we are also deflating over time and developing wrinkles, lipstick bleed lines, and darkening or even a mustache appearance around the mouth with age. In these patients, we can help them out by doing the fat treatment, and what we do is we take some fat cells out of the abdomen or the thigh, we turn them into a liquid to take out the stem cell portion called adipose-derived stem cells or mesenchymal stem cells, and we use this mixing it with platelet-rich plasma, injecting them both into the upper lip and around the mouth to increase the hydratatory status and the young, supple, brilliant, bright look of the lip. With this, you see that we get brightening of the darkened depressions or the mustache line around the mouth when it's not from pigment. We get brighter, more rosy lips, less wrinkling, and the lip just looks a lot healthier. Here we have a great example, which is a patient who got the fat lip treatment, and you can see from the before to the after that the upper is darkened all the way across here, and there's a bunch of little wrinkles that come down into the lip, and the lip lost its color. It looks like a light pink instead of a bright rosy pinkish red. Here in the after photo, you can see how much better it looks. That's from doing the fat treatment and the philtrum, as well as the lip over there, and we brought up the corners with a tiny bit of a corner lift. Here you can see from the side, it's very obvious here that you have that depression that comes all the way around, and it's dark. Here the lip is bright and it's reflecting light a lot better. So the lip just ends up looking healthier, younger, and this is without doing fillers, and we would consider this, although not a permanent result the rest of your life, you may have to repeat it, but a semi-permanent result where you can get rid of all that depression and make the lip look healthier and brighter again. This is a great alternative to excessive amounts of lasers or using fillers and things like that. Patients seem to love it. We've used this for the hair, we've used it for the mouth, and we use it for the entire face. But the changes that it makes are not only skin deep, it goes underneath and rehydrates those layers that have deflated over time, causing dynamic change around the mouth that makes people look older, makes them look like they're pursing their lips, and makes them look like they have a mustache line. So all of these things are proved with the fat lip treatment. The fat lip treatment takes only about 30 to 60 minutes to perform. We do a little bit of liposuction in the abdomen. This is done under local anesthesia. Sometimes we take a little fat out of the thigh, and we are not doing fat grafting. What we are doing is taking the stem cells out of the fat, using that as a stem cell potion, a magical potion mixed with platelet-rich plasma, and re-injecting it into the SMAS layer of the mouth. Sometimes we combine this with a lip lift, other times we combine it with a facelift, and other times we just combine it with doing radio frequency or laser around the mouth. This is a truly revolutionary type of procedure that tries to fix the problems underneath the skin rather than just camouflaging them by putting a ton of fillers. So people look more natural and rejuvenates things that we never even fully understand. A very exciting case where I performed a Cupid lift along with the fat lips and fat face procedure. You can see here when you're looking at the before picture, there's a granular texture change all the way around the mouth as the mouth has kind of contracted over time and she appears deflated with loss of color in the vermilion and these deep fissures around the mouth. When we look at the after photo, you can see that the lip is brighter, although she does have some lip gloss on there, but you can see the color is brighter. She is a lot smoother all the way around, and the Cupid lift procedure was able to bring up her central lip as well as the lateral lip, and if you look really closely, you can see how much the corners improved and the skin quality has improved by using not only the fat nanofat PRP combination, but by doing a corner lift as part of the upper lip lift, Cupid lift, to diminish these fissures on the lower lip and lower part of the mouth. The other magical part is how it heals. When you do fat lips and you do the nanofat with PRP, you can inject that same magical potion into the incisions and you can see up close how well those incisions heal. Now normally a Cupid lift heals well anyways, but this gives it a little extra support in the way of healing, but you can see all the way around the side of the face how much this patient has improved in those areas as far as the texture of the face and texture of the mouth goes. The fat lip procedure here did not give the lip any substantial increase in volume. It just made it look healthier, look more supple, look softer, look younger, and look brighter. These kind of changes that you see over time occur very, very commonly, especially in patients who have white skin and who have thin skin, and as they get older, they tend to get little wrinkles that happen in the dermis and the epidermis, and then underneath that in the SMAS layer they get some deflation, so it doesn't have as much support anymore, pushing the skin out. So you do notice that things start to become more concentric over time, start to get more depressions over time, and form more shadowing over time. And then when you move your mouth, all of the wrinkles get more exaggerated. So the lipstick bleed lines and the fine lines that occur around the mouth, when the layer beneath or the SMAS layer is deflated, they get more exaggerated because they fold onto themselves. When you do some injection with the NanoFat PRP, that stimulates the area to form more of the proteins that were lost over time, such as hyaluronic acid, and it tends to draw more water in and hydrate the entire area better. It also helps for healing. When you're doing a CO2 laser like we did on this patient, it helps them heal faster. So PRP alone can help, NanoFat and PRP helps even more. The ideal candidate for the fat lip procedure is a male or female who has aged over time and has deflation in the upper lip, and they're losing that really bright, radiant resilience of the upper lip. It really helps rejuvenate the SMAS and the deeper tissue layers. Nowadays, younger patients are putting too much filler. Their lips keep getting bigger and bigger and bigger. And when you dissolve those patients, you see all the damaged tissue. The fat lip procedure helps rejuvenate and refresh and repair damaged tissues or damaged SMAS layer that's in the face that either occurred from overfilling, excessive dissolving, or from excessive heat treatments that have been done in the face over time. So it's a truly revolutionary procedure which is going to help the health of the tissues rather than camouflaging the damage that's going on underneath. It's important to note that the fat lip procedure is not necessarily fat grafting. The idea is to use the stem cells from fat, called adipose-derived stem cells, use platelet-rich plasma at a very concentrated amount, and we're injecting these as a type of magical stem cell potion that goes into the deeper layers of the tissue and repairs them. In addition, if we wanted to do a touch of fat grafting, we can do that to areas of the face that are volume depleted, that need volume augmentation. But the main part of this fat procedure is that we're just injecting the stem cell potion of this to help refresh damaged tissues. The fat lip procedure is a procedure that came to me over the past 8 years of using NanoFat and PRP to treat patients with scar contractures who couldn't move their necks. I saw that if you injected fibrotic areas that had scarred down, you can actually give these patients more flexion and really help them. From there, I started using it for scarring in the face. I moved on to using it for hair rejuvenation and for hair loss. And Fat Hair is the original publication that we put out about a year or two ago describing the technique and how we use it for the scalp and hair loss to slow or stop hair loss as well as to get regrowth of hair. Eventually, I discovered that this magical potion, which it really mystifies me how it fully works, we inject into the SMAS layer of the face, and I saw that with patients who had been damaged by excess filler and dissolving or by heat treatments like Ulthera, I was able to get back a lot of what was lost. Taking this a few years forward, we've used it on hundreds of lips, and it is really incredible the change that you get even after a few weeks. And the important part is that it doesn't go away after a few months. It seems to last a very long time. The details to how this procedure is performed, which is called PHAT, P-H-A-T, has been published, and you can get the link below if you want to read about it. To contact us here or see more, follow me on Instagram at Dr. Ben Tale.